Dear students, today we are going to learn about a very important drug, heparin, which is a parenteral anticoagulant. It is used in the treatment of pulmonary embolism secondary to deep vein thrombosis. From this picture, you can see a thrombus formed in the deep vein, which is getting dislodged to form an embolus. And this embolus is getting deposited in the pulmonary blood vessels. And there will be symptoms of pulmonary embolism. For the treatment of this condition, we use a parenteral anticoagulant which can dissolve the blood clots, and that is heparin. So we'll be discussing under the following headings: introduction, mechanism of action, uses, adverse effects, and conclusion. Before going to heparin, we should know details about the coagulation cascade. Coagulation cascade is activated whenever there is an injury to blood vessel. When the blood vessels are injured, there can be bleeding, and this bleeding is stopped by the activation of platelets and the coagulation cascade. Together, they will form a clot. So, whenever there is activation of platelets, there is release of certain factors which will cause activation of the coagulation cascade. In the coagulation cascade, you have intrinsic pathway and extrinsic pathway. There are clotting factors present in the plasma. These factors are activated by the activation of platelets and release of activators. So the first intrinsic pathway, there is activation of factor 12, which causes activation of factor 11, which again activates factor 9. Factor 9 and factor 8 together activates factor 10. From the factor 10, you have a common pathway of coagulation. The extrinsic pathway begins with the release of tissue factor, which will cause activation of factor 7. And factor 7, along with calcium and factor 8, will activate the factor 10. And from this factor 10, the factor 5 activation, phospholipids and calcium together will cause prothrombin conversion to thrombin. And thrombin is converting fibrinogen to fibrin monomer and finally forms a fibrin clot. This fibrin clot is stabilized by factor 13, which in turn is activated by thrombin. So finally, together the intrinsic pathway and the extrinsic pathway will lead to the formation of a stabilized fibrin clot. So to summarize, you have an intrinsic pathway which starts from the activation of factor 12, and you have an extrinsic pathway which starts by the activation of factor 7, which is stimulated by the tissue factor. And both these pathways finally leads to activation of factor 10 and the common pathway of coagulation. Factor 10 causes prothrombin to thrombin conversion. Thrombin causes fibrinogen to fibrin conversion. And there is also a stabilization of the fibrin clot, finally forming a blood clot. So now the anticoagulants are agents which can prevent the formation of blood clot by several mechanisms. We have oral anticoagulants and parenteral anticoagulants. Oral anticoagulants include coumarin derivatives like warfarin and azenocumarol. direct factor 10A inhibitors, rivaroxaban, direct thrombin inhibitor, dabigatran. Parenteral anticoagulants include indirect thrombin inhibitors like heparin, low molecular weight heparin, fondaparinux. Direct thrombin inhibitors like lepirudin and bivalirudin. So today we are going to learn about heparin, which is a parenteral anticoagulant and is an indirect thrombin inhibitor. Heparin was first discovered by MacLean in 1916 from the blood of snails. He discovered the anticoagulant property of heparin. Heparin is a straight-chain mucopolysaccharide with a strong electronegative charge. It is a highly ionized molecule. The source of heparin is porcine intestinal mucosa. Coming to mechanism of action of heparin, we know that it is an indirect thrombin inhibitor. So usually we have unfractionated heparin, which is a high molecular weight molecule with 10,000 to 20,000 molecular weight. It has a pentasaccharide unit, which is the key part in its action. So heparin combines with antithrombin to form a complex, antithrombin-heparin complex. It actually forms a scaffolding over antithrombin and also will change the binding site of antithrombin. And this complex will bind with factor 10A and thrombin and will inhibit its action. So this complex is actually preventing the action of factor 10A and thrombin by binding to these molecules firmly. So it is actually indirectly inhibiting the action of thrombin. It also inhibits the factor 10A, so there will be inhibition of the common pathway also. So we can see that heparin is inhibiting the intrinsic and the common pathway of coagulation. Pharmacokinetics, we know that heparin is a strong electronegative charged molecule. So it is highly ionized and therefore is not absorbed orally. So we have only parenteral forms of heparin. It does not cross the placenta or blood-brain barrier. As it is not crossing the placenta, it is the anticoagulant of choice during pregnancy. It is metabolized by heparinase enzyme present in the liver and is excreted in urine. Uses of heparin include treatment of deep vein thrombosis and pulmonary embolism, where it helps to dissolve the blood clots. It is also used in the treatment of myocardial infarction, which is caused due to presence of clots in the coronary arteries. It is used in the coronary balloon angioplasty to prevent the blood clot formation and also to dissolve the blood clots. So the uses of heparin are DVT and pulmonary embolism in myocardial infarction and coronary balloon angioplasty. The dosage of heparin used, it is given as IV bolus of 5,000 to 10,000 units, followed by 500 to 750 units continuous infusion. Or we have a subcutaneous dosage of heparin, which is 10,000 to 20,000 units given subcutaneously every 8 to 12 hours. An important thing is that we should always do the APTT monitoring in order to see whether the heparin is given in an overdose. APTT is activated partial thromboplastin time, which helps us to know the heparin adverse reaction, which can cause bleeding. Adverse effects of heparin include bleeding. When heparin is given in overdose, it can cause spontaneous bleeding. Hematuria is usually the first sign of bleeding. If it occurs from intracranial sites, it can be very serious to the patient. Another adverse reaction is thrombocytopenia due to the aggregation of platelets. One condition called heparin-induced thrombocytopenia may occur in certain individuals. It is actually an antibody-mediated condition which will destroy the platelets. This condition may become dangerous, and therefore if a patient has heparin-induced thrombocytopenia, we should stop heparin immediately and you should treat the patient accordingly. Heparin can cause osteoporosis if it is used for a long term. It can cause reversible alopecia in some individuals. It can cause hyperkalemia. So the adverse effects mainly include bleeding, thrombocytopenia, osteoporosis, alopecia, and hyperkalemia. Antidote to heparin. If the heparin given is going to toxic levels, we should give the antidote, which is called as protamine sulfate, which is actually obtained from the sperm of salmon fish. It is a strongly basic molecule, so it will counteract heparin, which is a strong acid. Contraindications to the use of heparin include any bleeding disorders. Heparin should not be given to patients with history of bleeding disorders like hemophilia. It is contraindicated in case of heparin-induced thrombocytopenia. If the person has a history of heparin-induced thrombocytopenia, we should never give heparin again. Persons with hypertension, if it is severe hypertension, if heparin is given, it may cause cerebral hemorrhage. So we should never give heparin to patients with severe hypertension. In the case of large cancers, heparin can cause a bleeding inside the central part of the cancer. So it can be dangerous. Heparin should not be given during ocular surgery or neurosurgery due to the fear of bleeding. And it should not be given during lumbar puncture. If the patient is planned for lumbar puncture, we should stop heparin before that. So the contraindications are bleeding disorders, heparin-induced thrombocytopenia, severe hypertension patients, large cancers, patients undergoing ocular and neurosurgery, and even the lumbar puncture. Now, a few words about low molecular weight heparin. It is actually fractionated heparin and has low molecular weight of 3,000 to 7,000 in comparison to the unfractionated heparin, which is having 10,000 to 20,000 molecular weight. Some of the common low molecular weight heparin preparations are enoxaparin, dalteparin, tinsaparin, and reviparin. Mechanism of action, it is mainly acting by factor 10A inhibition. So the low molecular weight heparin binds with antithrombin, and antithrombin low molecular weight heparin complex will inhibit the factor 10A by combining with it. Certain advantages, or what are the differences of low molecular weight heparin compared to unfractionated heparin? Low molecular weight heparin has less effect on the partial thromboplastin time and the whole blood clotting time. It has less antiplatelet action, and it has less thrombocytopenia and less hemorrhagic complications. It is eliminated by renal route, so we should not give in cases of renal failure. So it has less hemorrhagic complications, less thrombocytopenia, and less effect on the clotting times. So what are the advantages of low molecular weight heparin? They have a better subcutaneous bioavailability. That is usually 70 to 90% compared to the unfractionated heparin, where it is only 20 to 30%. Action of low molecular weight heparin is longer and more consistent half-life, about 4 to 6 hours. So we need only once daily subcutaneous administration. And the APTT or clotting times are not prolonged in case of low molecular weight heparin. So laboratory monitoring is not needed frequently. The risk of osteoporosis after long-term use is much less for low molecular weight heparins. So to conclude, heparin is a parenteral anticoagulant which is acting by inhibiting the factor 2 and factor 10A indirectly. That is, the thrombin and factor 10A indirectly is inhibited by heparin. It requires strict APTT monitoring, and the common adverse reaction is bleeding, which should be carefully monitored. Heparin is primarily used in the treatment of deep vein thrombosis and myocardial infarction. And there are low molecular weight heparin which is available, which is having less side effects compared to unfractionated heparin, and which does not require strict laboratory monitoring. And there is less incidence of hemorrhagic complications and osteoporosis for the low molecular weight heparin. Thank you.